Minutes past 8. Thank you. The fight on the front line of this pandemic is already underway for our NHS staff, who will face enormous challenges in the weeks ahead.
Let's hear now from some of the healthcare workers who are working so hard to limit the impact of coronavirus.
Day in and day out,
we help as best we can in whatever way we can.
Whether we're doctors,
porters, nurses, cleaners
or radiologists.
We are one NHS.
And we are on the front line of this pandemic.
Coronavirus has landed.
And we are doing the best we can.
With limited resources and staff.
It's going to be tough and maybe even overwhelming.
We aren't soldiers.
We can't do this alone.
But we are not alone.
We are one people.
We can rely on each other.
And with your help, we can get through this.
Help us to fight the virus on the wards,
in the community,
and in the labs.
Help us to keep safe in body and mind.
Help us with a place to stay to keep our loved ones safe.
Help us with the day-to-day.
For childcare.
Or a cab.
To get us to work and help our patients.
Some real heroes out there, aren't there? We can speak now to intensive care specialist Professor Mike Grocott and also to Richard Webber from the College of Paramedics, who join us live on Breakfast. Thank you very much to the pair of you for sparing a bit of time. Mike, you've just come off a night shift, is that right? How's it been?
That's right. So I think I'm down in Southampton. I think we're relatively lucky. We've had a couple of more patients who've needed ventilators overnight. And we can see from the number of patients in the community in the hospital, which is building up, that there's a breaking wave coming towards us. But I have a huge amount of sympathy for my colleagues in London, who I know are already extremely busy.
Yeah, we've heard, haven't we, that they might be a couple of weeks ahead of everyone else. Have you got enough equipment? We've been speaking to NHS providers for the people that need it at this point.
So we have where we are. I know from chatting to colleagues around the country that some people have been nervous and others have been properly concerned that they're running short. My understanding is that's being dealt with very seriously from NHS England and others. But I know there's concern because healthcare workers are worried for themselves, but they're also really worried because if we get sick, then we risk making patients sick, and we risk undermining the resilience of the health service itself. So it's that personal protective equipment is really important for maintaining the NHS.
Richard, let's come to you. Can you give us an idea of sort of the impact that coronavirus is currently having on paramedics?
Good morning. Paramedics are working extremely hard, along with other ambulance staff on the front line, going out to patients. As you heard there, London seems to be ahead of the rest of the country. It's been much, much busier there. There have been some issues with PPE. Generally, it's fairly good, but there's certainly been some areas of the country where our members have reported that they've struggled to get the right PPE. There are different kinds. One of the masks needs to be personally fitted to each paramedic, and they need to wear that manufacturer make of mask. So it's really important that enough masks are available to protect staff. Paramedics are working extremely hard, but they're concerned because not only is there a problem if they pick up the virus that they may infect other patients before they're aware they have the illness, they often live with elderly or small children, and they're very, very concerned about taking that back to their families.
Of course. And Richard, just give us a sense of how many times you've been called out to help someone who may have coronavirus.
I've been called out personally a few times to people that have subsequently tested positive for coronavirus. And what we would say is, if you have mild symptoms, self-isolate, stay at home and look after yourself. You don't need an ambulance. You don't need to go to A&E. You need to stay at home until you get better. Clearly, if your condition deteriorates and you get severe difficulty in breathing, then absolutely do call an ambulance. But please, we need to make sure the ambulances are there for the sickest people who need us.
Mike, what is morale like amongst the people that you work with? You mentioned about that sort of wave, waiting for that wave to hit. Are the people that you are alongside in the hospital, are they feeling okay? Are they sort of preparing for this, you described it perfectly, as a wave of cases that may well come, we expect?
So they are. I mean, there's undoubtedly fear and anxiety, but through adversity, it's astonishing how people rise to the challenge, and everybody, across the service and across the hospital are working really hard, preparing, and the response from our retired colleagues and people who've maybe gone into other areas of activity who are really compelled to come back and help has been really encouraging.
And Mike, and just give us a sense, and of course, patient confidentiality is something that's very important. So just on a sort of general sense, what is this like to treat?
So in some ways it's very straightforward. It's like in many patients it's like a pneumonia where in intensive care particularly we're used to treating people, putting them onto ventilators and supporting them through that and the recovery and all the decision making around that. In other ways it's very challenging, partly because of we're not that used to dealing with PPE to the extent that the protective equipment to the degree that we're having to use it at the moment, and the knowledge, the logistical setup for the very large number of patients that we anticipate, it means that almost every normal activity is changed, and we've got lots of people shifting roles to support the intensive care work, and lots of training and preparation going on for the coming onslaught.
Yeah, to go on that onslaught, Richard, how are you prepared as paramedics for the potential peak?
I think it's a problem. We are doing lots of training, making sure people are ready to deal with it, but it's also about building resilience. We have a concern. We have a number of staff who are already off work with symptoms, or people who have long-term conditions and can't be at work and actually feel guilty about not being able to come and support their colleagues. So it's about people staying physically and mentally well and preparing themselves for what's going to be very, very challenging times ahead. So I would say again to the public, please stay at home, you'll save lives.
I wanted to ask you both that question, actually. Let me pick up with Mike Grocott, if I could, and you've kind of answered, Richard, but yeah, very stringent restrictions on all of our lives now. What would you say to people about sticking to them?
So this is a time of real threat to all of us, and particularly to the most vulnerable, and I think kindness and compassion is absolutely essential as a whole community, and the kindest thing you can do at the moment is to stay away from people who aren't in your own household. Stop the spread of this virus. It spreads by direct contact. The more we can do to limit that, the more we will limit the stress on the NHS and make sure that we all get through that. So I think it's a really, really important message.
Well, thank you very much, the pair of you, for not only coming on the programme today, but for the work that you're doing at the moment. Thank you very much. I hope you can stay safe for the next few days and weeks ahead.
And thank you so much. It makes a very good point there about kindness being a reason to actually, do what we are being told.